Man's age-old quest for eternal youth and celebrity is the thirst of the mortal for immortality. Tireless effort and ceaseless thought, innumerable sciences and infinite philosophies have all revolved around this priceless pursuit across vast spectrums of space and time. The great seers of ancient India gifted the world with two majestic legacies that proved new pathways in the art of healing and rejuvenating the body: Ayurveda and Yoga. Ayurveda, the science of life and longevity, defines the harmonious blending of the individual body, mind, and spirit with that of the cosmos. As per the Hindu mythology, Brahma, the cosmic creator, composed Ayurveda in 100,000 verses and gifted it to mankind. Thus, this ancient system of therapy, as old as a civilization which treasured it and which it nurtured, continues to flourish in the land south of the Himalayas. The principles of Ayurvedic pharmacology are fundamentally different from that of other systems of medicine, especially the allopathic system of medicine. The vast majority of Ayurvedic medicines are prepared from various herbs. Leaves and flowers are squeezed to obtain their juice. Roots and seeds are crushed and boiled with water to get their essence. To make a decoction, the extracts of plants may again be boiled with other vital ingredients. In other words, Ayurvedic medicines are often prepared under the supervision of an expert physician using classical herbal prescription. Unlike other medicinal systems, the pharmacological process closely resembles the culinary art. This natural system of medicine with a singular pharmacology entails the practice of various unique therapies. Oil therapy is one such example par excellence. It is the application of medicated oil, either internally or externally. It includes pouring of medicated oil on the crown, chest, or on the back in a tank of dough. Local application of medicated paste in certain inflammatory conditions is also a common method. Svedhanam, or therapeutic sweating, is an unparalleled Ayurvedic treatment. Different methods are adopted for application of warm medicated oil on the body. The oil is either poured directly or by squeezing a piece of cloth dipped in it. Sometimes it is applied through a poultice called kiri, filled with bolus of cooked rice, leaves, or medicated powder. To liquefy the toxins in the body, internal and external oleation is necessary. During treatment, the patient is made to lie on a droni. Droni is a special wooden bed shaped to the contour of the human body. The surface of the bed is not flat but slightly convex. There is an oil outlet near the headrest. At the bottom, there is a spout through which oil can be collected in a receptacle placed below. Earthen, brass and bronze vessels are used for filling aids. From time immemorial, human beings have been searching for an elixir or amrit, the magical potion to stay young and healthy forever. To fortify the system against diseases and aging, Ayurveda recommends the Panchakarma or the 5 actions, a set of rejuvenation therapies designed to purify the body of toxins. Diseases are primarily caused by the presence of amam or toxins in the system. These are usually micromolecules of improperly digested food which gets absorbed by the body. The elimination of toxins is done through Panchakarma or 5 therapies, namely Nasyam, nasal therapy, Vamanam, drug-induced vomiting, Virechanam, purging, Vasti, therapeutic enema, and Rakta Mokshana, bloodletting. Each of this pentad of action is carried out in 3 stages: the Purva Karma, preparatory procedure, Pradhana Karma, the main course of treatment, and Paschat Karma, post-treatment care. Now, let us have a look at the various Purva Karma and Panchakarma therapies. Snehapana is internal oleation or the oral administration of medicated ghee. A prerequisite in all the Panchakarma therapies, this is the first step in the Purva Karma or preparatory procedures. Abhyanga means anointing. In Abhyanga Snana, medicated oil is massaged all over the body. The Abhyanga, that is part of the daily routine, lasts for 5 to 15 minutes, whereas that which is performed for treating diseases may take about 45 minutes. Massages in Abhyanga can be effectively done with 2 therapists working on either side of the patient who lies on the droni. Special care is to be taken for Pada Abhyanga or foot massage. The marmas or vital points on the soles of the feet are closely related with certain internal organs. The soles of the right feet are massaged in clockwise movement and the left feet in anti-clockwise. The patient reclines in 7 standard positions during this process. This begins with the person seated in an upright position. Lying supine or flat on the back is the next. Then, the body is turned to one side. Supine again. Then, turning to the other side. Supine once again. And finally sitting as in the beginning. Sometimes the position of lying face down is also adopted. Many are the benefits of Abhyanga. Besides strengthening the muscles and blood vessels, it increases the flow of oxygen to the tissues and improves circulation. Massage with medicated oils gives a luster to the skin. Regular massage removes stiffness from the joints and helps graceful body movements. Medicated paste applied on the crown or forehead is called thalam. Different kinds of thalams are prescribed according to the nature of the illness. Treatments like Pirichal, Navarakiri and Sarvangadhara are preceded by the thalam. covering of the head with medicinal paste is known as Talapodachil. It is an important treatment for many minor and major diseases that afflict the head. The hair on the head should be completely shaven or cut short. The paste is applied on the crown to a thickness of 3 centimeters. After a prescribed time, the paste is removed and a fresh coating applied. The duration of the treatment is specified by the physician. Shiravaste is one of the major external oil therapies for Vata-related ailments of the head. A leather cap open at both ends is worn on the head. The prescribed oil is then warmed, poured into the cap and allowed to stand for a specified time. The duration of the treatment varies from 5 to 50 minutes in accordance with the seriousness of the illness.